Hello, everyone. I am excited to get back on and answer some questions today. As we begin, I want to give you an exciting announcement. I just found out literally like 40 minutes ago that I do have a book deal, and I'm going to be working very hard. I have to get this book to the publisher by May 24th is my deadline. So I have to write a book between now and May 24th. I have the book outline done, all the information, but it has to be turned into a book. So it's going to be a lot of work, but I'm excited to share as I go. And the interesting thing is, so this book will be published next year. It's kind of crazy. The way the publishing world works is I deliver a book, to them May 24th this year, and we're hoping to publish mid-March of 2025. So it's exciting. But I wanted to share a really interesting story that I'm literally researching today. So I'm writing chapter 2, and chapter 2 is all about my story and about how Mercury affects me. Actually, let's tell that. I'll tell that in just a moment when we get a few more people on here. But I do want to tell the thing I've been finding out. So I'm wanting to learn, what do toxins actually do to our cells? Like literally what happens to them, what changes in the machinery and the inner workings. And because the whole book is about how to counteract the things that we are dealing with from our world, the toxins, the food, everything else. How do we reverse it? How do we help our cells to work better? How do we add energy to every single cell in our body? All these kinds of things. So that's what the book is about. So I'm doing some backstory here at the beginning, talking about, well, how do these things actually affect us? Because if we can understand how one cell works, we can understand how to make every one of our cells work, which is really kind of the whole premise of the book, and how to give limitless energy through all of these things. So I've been studying about lead and lead poisoning. And the story that I just found that I've been really writing about is fascinating to me. It was back in the Roman Empire. And what they figured out, well, they were drinking a lot of wine. They said the men at the time were drinking a liter of wine a day each. That's a lot of wine. So as they were making wine, there's a byproduct of unfermented grape juice. Sometimes there's unfermented grape juice. So they would boil this in their pots. Well, their pots were lead based. So they would boil it in the pots, and they would boil it for a long time, and it would reduce down and basically make a concentrate. Well, the concentrate they found was very sweet. And they found that the more lead was in the pot, the sweeter the concentrate was. What they didn't realize is that the lead was interacting with the acetate in the grape juice, and it was creating what's called lead acetate. At the time, they called it sugar lead. So they figured out if they can make pots out of just lead and boil this grape juice down, they could make this sugar acetate. They would concentrate it out, precipitate it out, and it was a white powder, kind of like table salt, that they would use. Well, I guess they loved sugar. They loved sweeteners. This was the first artificial sweetener and they loved it. So they started adding it to all the foods. 20% of their food supply then started to have this artificial sweetener or sugar lead added to it. Add that to the problem that they had real revolutionary plumbing systems in ancient Rome. And the water, they had all these ductworks and aqueducts and things. In fact, I've been to Israel and saw some of these areas along the coast that the Roman Empire had built. They're pretty phenomenal. Well, a lot of this piping was lead based. So they had lead leaching into the water from the lead pipes. They had lead acetate in 20% of their food, and they started showing some symptoms of lead poisoning. Well, what does lead poisoning lead to? It leads to growth and development issues. It leads to cognitive or brain issues, neurologic problems. And it's interesting because historians have hypothesized that perhaps this lead acetate or this lead problem was the reason for the decline and the fall of the entire Roman Empire. So what I've just figured out today is artificial sweeteners led to the fall of the Roman Empire. Pretty much in a short sentence. Kind of crazy thinking about this, thinking about how toxins have been a part of our world for so long. And it's really important that we know how they work so that we can avoid them and let our cells work well. Anyway, fascinating. But I do want to tell the part about Mercury, because to me, this is so crucial for what you are on here wanting to know about is dental health. There was a recent research article released literally just a couple of weeks ago. And what it was looking at was levels of mercury in urine of women. And it was testing women that were pregnant. Basically, it wanted to see women that were pregnant, how much mercury was in their urine. And so they were looking to see people that had mercury fillings in their mouth, those silver amalgam mercury fillings that have 50% mercury in them. They were looking to say, okay, if they have at least one of those fillings in their mouth, what is the mercury level in their urine? And then if they have zero fillings in their mouth, what is the mercury level in the urine? And what they found is those that had even one mercury filling in their mouth had 2.5 times the level of mercury in their urine. Well, this is particularly worrisome, not only for the woman, obviously, but also for the baby, because there's been numerous studies showing that, yes, this mercury does migrate from mom into the placenta and into the baby. So high fetal levels of mercury have been associated with women who have mercury fillings in their mouth as they're pregnant. And this is interesting. I learned this years ago before this information came out, that the first baby detoxes a large, like 80% of mercury from the mom. And it's interesting because I was my mom's first baby, and she had a mouth full of mercury fillings. And I just wonder how much of that mercury actually was in me before I even started doing dentistry and putting a whole bunch more in me. And if that wasn't part of the piece to why I got so sick from this, I think it probably is related. So that is one thing that's really worrisome. If mamas, if you're going to get pregnant, if you're, planning to have a baby, just even for your own health, though, get the mercury fillings out. What they showed is the vapor coming off of these fillings was, 36% times higher than EPA allowable levels in the state of California. So just the vapors of just existing was higher than what they even allow for mercury levels, 36% higher. So this mercury thing is a big deal. Not only that, but mercury affects reproductive health. So women and men both, if you are interested in having a child in the future, you need to get rid of the mercury because it actually damages reproductive organs. And I got a little emotional on a story this week talking about this because I have not been able to get pregnant in over 30 years of marriage, never gotten pregnant on my own. We had medical wonders that through in vitro had my twins, and then we adopted 2 other children. And if I'd have known this about mercury, I would have done something about it. So this is now part of my mission, is to let you know that this is a big deal. This is a big deal. And you need to get that those mercury fillings out of your mouth. Of course, like I always say, you need to remove this safely if you're going to remove it, because it's almost worse to get it removed and just breathe it all in and swallow it all and have it really intensify the levels in your system. So make sure you're going to someone who's going to remove it safely. What does that look like? Well, there's a few different things that we do. First of all, we cover everything. So mercury will absorb through the skin. It will absorb through the nose. So, breathing it in, you'll swallow it. All of these ways it's going to get in you. So we cover everything. We cover, we have like a sheet that goes over top of you that's disposable that we chuck, when you're done. We have a thing that goes over your face. You can see through it. It's not like, you're going to feel claustrophobic. There's a little screened area so you can see through it. We put a nose, oxygen mask on your nose so you're not breathing it in. We have a rubber dam that keeps all the mercury out. We have a giant vacuum that sits at your chin that sucks all the vapor as it's coming off away from you. We have a lot of different things. And then the dentist and the dental assistant wears a special mercury filtration mask. We don't want it to get into us. We don't want it to get into you. So make sure when you're going to have these mercury fillings removed that you're going to do it safely, because that's also part of the problem here. So mercury affects your cardiovascular system, so your heart. It affects your reproductive system. It affects your brain, just the way your brain is cognitively working. It affects your neurologic system. This is why I had so much numbness. This is why I couldn't remember anything. Mercury affects all of these things. And if you're having any of these kind of issues, you need to look at mercury. You need to get the fillings out. All right, so let's get to questions. Do you recommend sealants on kids on permanent molars? I heard they are not BPA free and it's very bad for kids with MTHFR gene mutation. What are your thoughts? There are sealant materials that are BPA free. So you need to ask specifically, can you please use a BPA free sealant material? There is such a thing. What is the purpose of a sealant? So there's a lot of cracks and grooves in the top of a tooth like this. And the most commonly decayed surface on teeth is the chewing surface. So when people look research-wise at all of the teeth and all the cavities that people get, where are they most commonly getting cavities? It's the chewing surface of molars, because they're like this. There's a lot of places and nooks and crannies for things to get stuck in there. So what a sealant does is, instead of having this, it seals over all of these grooves. So it makes it so things don't get stuck in those grooves, in those areas. The idea is good. There's a few problems actually with sealants. The number one problem is that often there's already cavities in these nooks and crannies. There's already ones down in here. So you need to make sure very, very carefully that there is no cavity already in that tooth. Otherwise, you're going to seal the cavity in and make it grow a little quicker. We find this as a cavity sealed under sealants, and then we can't find them as easily. So make sure that the tooth is very, very clean, that there's no decay on there, and that the sealant is done well and doesn't leak. So honestly, I almost prefer not doing sealants and just doing hydroxyapatite varnish or hydroxyapatite at home every single day, rubbing it into those chewing surfaces. So you can brush and then take a little bit of that powder, the tooth powder, use it as a paste and just brush it into the chewing surfaces of the teeth. So that's very, very, very good, effective way to do that. Okay, what does it cost to get a mercury filling removed properly? Well, it depends a lot on a lot of things. It depends on the size of the filling. So if it's just a single, like the chewing surface only, that's going to cost a lot less than if the filling, takes up 3/4 of the tooth. So it really depends on the size of the filling and what it's going to take to restore it. So I wish I could give you a number on that, but it really doesn't. It's really hard to tell you. The actual safe removable portion, we don't even charge extra for it in our office. We just do that routinely for everybody. So if anything, I've seen people charge maybe $50 as a safe removal fee on top of the fee to remove it. That I would say is probably industry norm. But really the cost of it's going to depend on the size of the filling, because that determines what treatment's going to be needed in the future. Okay, a good question here. I almost scheduled an appointment for my child at your office. However, they mentioned having to have a CT scan prior to any treatment. Are you offering the benefits by exposing them to so much radiation? Great question. So we are only doing CT scans on someone that is 12 and over. And the reason that we're doing that on a 12 and over is because we want to see growth and development. So I am looking for a lot of things. I am looking to see airway. I'm looking to see tonsils. I am looking to see nose, if they have a open nose so that they can actually get nasal breathing. A lot of growth and development happens because of nasal breathing. So if they're mouth breathing, they're totally missing out on that. We're looking to see wisdom teeth development. We're looking to see, are any other teeth developing? We're looking to see a lot of things that we cannot see on a traditional dental x-ray. So that's the reason. And is there a benefit beyond, for the radiation? Absolutely. And radiation is not the same as a CT scan when you go to a hospital. It's not the same at all. We also do a couple of things after. We give you what are called tocotrienols. It's a kind of vitamin E that mediates or mitigates the radiation in the body. There's also homeopathics that you can use if you're concerned, glutathione, antioxidants. There's a bunch of things that we can recommend. We give some of them to you standard, but we also have some available if you're concerned. So we do things to mitigate the radiation, but I absolutely believe 100% it is worth it. And it's much less radiation than a traditional CT scan. It's nothing like what you do in the hospital. If you're younger than that, we recommend what's called a panoramic x-ray. What that panoramic x-ray is it just shows growth and development of the jaws themselves. I don't see jaws, or I don't see like the jaw joint. I don't see the airway, but we see, are the teeth coming in correctly? Do they have any issues? Sometimes we'll find on a kiddo a cyst in the jawbone, those kinds of things. So we're looking for that. We're looking to make sure the teeth are coming in correctly and everything's growing as it should, making sure they have all of their teeth, that they're not missing any permanent ones, that kind of thing. And that's routinely done at any dental office. Those are even lower radiation than the CT scan. But yes, there are reasons that we do that scan, and it's so that we can see growth and development issues and bypass them. A lot of times, if I can help a child's mouth grow properly, it eliminates the need for braces. It eliminates the need for wisdom teeth removal. I was just on a call this morning talking about this, that if we can expand a child's mouth wide enough, that it will allow room for wisdom teeth to come in and to function properly, so we don't have to take them out. So is that worth it on a 12-year-old? Absolutely. Let's grow their mouth right so that they can grow right, so that they don't need braces, so that their airways open, so that all the things are working functionally, working correctly, and so they don't have to get their wisdom teeth out potentially. So yeah, lots of reasons there. Sadly, I didn't know about the mercury danger when my 6 molar fillings were replaced with crowns back 15 years ago. Now I need to do a slow detox for heavy metals. Exactly. And you can, and I do. I still detox with heavy metals, and you can still do that. What do we use to expand their jaw? So on a child, what do we use to expand their jaw? Depends on the age. I was just talking with my son and daughter-in-law this morning about their 2-year-old. At 2 years old, we can start doing expansion. I just learned a really interesting statistic, that with expansion of the top jaw, my little grandbaby has her teeth are so tight, and she's 2 years old. They're so close together. They should not be like that in a child. In a child, you should have a lot of space between every single baby tooth, because the permanent teeth are bigger than the baby teeth. And how are the permanent teeth going to ever fit in the mouth if the baby teeth are already crowded? She's extremely slow at teething. And I really believe this is part of the problem. There's no room for the teeth to come in. So we were already talking. So even starting at a 2-year-old, we can use something called MyoBrace. And in a 2-year-old, we use an infant trainer. And what it is it's kind of a flexible mouthpiece that they chew on. And they chew on it, and it directs the growth of the mouth with this chewing. And we go through progressive different mouthpieces as they get older. They're not custom mouthpieces. They're ones that they're sized by your age. And so they just kind of progress as the mouth grows, and the mouth progresses as well. And it directs the growth and development. Now, sometimes we need to do a fixed expander. So if the child is old enough that we're able to take a mold of their teeth and glue an expander into the roof of the mouth, so it's glued onto 2 molars, and then there's usually an expander that goes across the roof. What they showed, this was crazy. What they showed was that within, I'd have to look at my thing, I believe it was in 3 months, they can have a 60% reduction in tonsil size in 3 months of expansion. Why? Because oftentimes those tonsils are inflamed because there's no room for the tongue. There's no room for air to get through. So they end up hanging their mouth open. We get hot, dry air hitting the tonsils. They get swollen even more. So if we can expand the roof of the mouth, make room for the tongue to come forward off of those tonsils, room for the air to pass, room for nasal breathing or nose breathing to happen, then all of a sudden those tonsils go and go down. My little grandbaby's sick right now. And I was saying, you know what, let's make some more room so the tonsils can be more effective at keeping her well. So much happening here with this. 14-year-old daughter breathes through her mouth. Is there something you can do about it? Absolutely. This is what I'm talking about. This is what I'm talking about. Yep. On 14-year-old, we're probably going to do a fixed expander to start with. We want to make a lot of room. When she breathes through her mouth, the problem is there's not enough room for the tongue, or she's got a tongue tie. So if the tongue can't go to the roof of the mouth and make a seal, I want you to do this right now. I want you to breathe through your nose and pay attention when you're breathing through your nose. What does your tongue do? Can you feel how the back of your tongue goes up to the roof of your mouth and seals it? It has to be able to do that in order to breathe through your nose. So if her tongue can't go to the roof of the mouth, first of all, because the roof is too narrow or because the tongue is tied down, you can't breathe through your nose. Just won't happen. So we have to look at the tongue function. We have to see, okay, do we have to do a tongue tie release? Can we retrain the tongue to come up and forward? We need to make more room for the tongue. All of these things can happen and need to happen at 14. 14 is wonderful. I'd so much rather fix her at 14 than 34 or 54 or these other ages where we're working on people. If a child is already 1 year old and has no teeth, is that a concern? No, it just means that they're slow teether. They may be crooked, and this may be part of the reason they're coming in slow. But no, it's not a concern. They'll come in eventually. All right, we're going to jump to another place here. Have I ever had a patient who was not compatible with a ceramic implant? I had mine placed six weeks ago and seemed to have a constant burning sensation. I've done an x-ray. It's not close to the nerve. Ozone seemed to calm it down for a week, and then the burning comes back. Have you seen where it takes this long for the healing process to happen? Any tips to help the process? I had a titanium implant previously, and after 2 years, the bone did start to regress. I actually have not seen anyone that wasn't compatible from a biocompatibility standpoint with a ceramic implant. Sometimes they don't integrate to the bone. But the interesting thing about ceramic is they usually don't cause pain. So the fact that you've got this burning sensation tells me that there may be some sort of body's reaction to even just the fact that something is in there. So what I would do is I would work on your histamine levels. There are some homeopathics that you can take specifically for histamine that will decrease histamine. I would really focus on that immune reaction that's happening and see if you can't decrease it. The other thing that I would do with burning is I would tackle zinc. I would increase your zinc levels. Oftentimes burning is a zinc problem. So I would do zinc. I would rinse with a mouth rinse with colloidal silver is the key. We want to make sure there's no bugs growing in there. And then I would work on histamine levels using a histamine homeopathic and see if you can't calm that down. Would you ever recommend an implant right after an extraction? Okay, so this is a maybe sometimes answer. So the reason we usually don't recommend an implant right after extraction is because an implant has to have bone on all sides. So it has to have bone above it here, it has to have bone below it here, it has to have bone on either side, not at the chewing side, but all three sides basically have to have a bone. And let's say you take out a tooth that's this big and we're putting in an implant that's this big. There we go. That's this big. Well, there's not enough bone to hold that implant in place until the bone heals. So if we're talking about a molar, typically we're going to wait. We're going to wait till the bone heals and there's enough solid bone to put the implant in. If we're talking about a very front tooth or one up right in here, we're sometimes going to put it in the same day because what happens is when the tooth comes out, the bone will collapse. And on a front tooth, then we have to rebuild it. So to reduce the chance of that happening, we'll sometimes put an implant right in the same day so that the bone doesn't collapse. So front teeth, same day, yes. Back teeth, usually in our practice, no. And we've just found that from experience. What is the best way to ask about airway? Is that best to be seen on a cone beam CT scan? Yes, that's exactly where you need to go. The only way we can see that is on a cone beam CT scan. I just had ozone therapy and I seem to get headache afterward. Is that common? I suspect you have an MTHFR gene mutation, or I don't actually like to even call it a gene mutation. I like to call it a gene variation. I have it as well. And what it does is it makes it so we can't metabolize things the same way. Most likely you have it. So if you are getting a headache after ozone, you're going to need to use an antioxidant. And the best antioxidant is glutathione. So what we do when we use ozone in our offices, we just hand you a packet of glutathione as you're walking out the door. So that's what you need to do, is you need to take some glutathione right after you're using that ozone. This is an interesting thing to find out because it's probably going to affect the way that you metabolize nitrous oxide in the dental office, or even just medications in general. Probably you're going to have it a little different. Do we cut lip ties? We do. So we use a laser for that. So we do lip ties and we do tongue ties for infants and for adults, both, everybody. But yeah, we do use a laser for that. How do I detox my 10-year-old? That's a great question. And, that's a little bit of a loaded question. So what I'm going to recommend is you talk to a functional medicine practitioner about that one. Or if you dare, go online and see what you can find about, a natural, gentle detox for a 10-year-old. There's a lot of things that can be used. I typically like to stay food-based if I can. So that's what I focus on, is food and what things can detox. Salt, a real good salt, is a really natural detoxer. So is iodine, also a very good natural detoxer. These are things that really you probably ought to have monitored as you're doing on a 10-year-old though. Do you recommend a certain toothbrush for a toddler? I have a silicone one. So we actually have toothbrushes coming out in hopefully a couple of weeks. They're bamboo with non-BPA bristles on them. Honestly, the key for a toddler is something that they'll allow you to put in their mouth. That's the key. Something they'll allow you to put in their mouth. So I do like electric ones just because they're kind of fun for them, especially if they play music and things. And if they allow you to let it stay in their mouth a little longer, all for that too. So just whatever your toddler will let you use. What do I suggest for a bone spur post-root canal extraction? Bone spur is usually a piece of bone that was dislodged during the removal process. Usually that bone spur will work its way loose and work its way out of the gum. If it won't do that, then you may have to have that reduced. If it's just a bump and it's really not bothering you, then a lot of times that remodels as well, or basically kind of smooths off over time just naturally. So if it's not bothering you, I'd leave it alone. If it is bothering you, you probably need to have it removed by that surgeon. What special dentist do you look for? So first of all, go to our website, livingwellwithdrmichelle.com. Check out the Find a Dentist directory on there, because you're going to look for somebody who's looking at your health and considering that when looking at your plan. This is interesting. Just this morning, I was talking with my running partners, and I was telling them a story about how I'm working to hire a new dentist right now. And one of my partners said, "You need to hire a new dentist. I just called and they told me if you want to see Dr. Michelle, you have to wait till next February." And I said, "I know, this is ridiculous. I'm working on this. But that's one of the things that I work so hard to do, is make sure that you do find somebody who's trained well. And this is something that's a little tricky. Go on that directory. These are doctors that have been trained to look for your health And that's why we have so many people coming to see us, is because we look at their health first. Sometimes I don't even talk about your teeth. I talk about your health. But that is what you want, is find somebody who is going to consider your health at the same time. So you're going to look for holistic, biologic. Sometimes people will call themselves a functional dentist. All of these words mean the same thing. They're all somebody who's looking at something other than just your tooth health. Do you recommend chewing on the area where a root canal was extracted while waiting for the implant? Well, not necessarily. Pressure leads to bone loss. So you don't want to be putting pressure on that bone. And in the short interim time before the implant's placed, you're not doing it a benefit to stimulate it. You are actually causing bone loss. So no, you really don't want to be chewing on that area. Can I use the remineralizing tooth powder on an already existing cavity? You can. Is it going to heal it? Well, only if it's still in the enamel. So if it's just a little one still in the enamel, you can put the remineralizing powder right on that and can expect that it may heal. But the key is, how deep is that cavity? It won't hurt it to put it on it. It won't hurt it. So you can put it on any size cavity, but it just may not be the only answer you need. If a toddler has a small gap in the top teeth, will adult permanent teeth come in that way? No, we actually want gaps between toddlers' teeth. That's a good thing, because look at the size of those toddlers' teeth. Look at the size of your teeth. You got to fit a much bigger space or tooth in that space eventually. How do you feel about oil pulling? Oil pulling is great. What oil pulling does is it, in essence, just manages the bacterial load in the mouth. So that oil attracts bacteria, pulls it from everywhere. So it is going to decrease the amount of bacteria, good and bad. It's non-selective, so I don't do it every day. I do it about 3 or 4 days in a row, and then I'll do it every 3 days or so, just to kind of keep things balanced. I had a cleaning and the assistant nurse was really harsh and caused a cavity. Is it common that you get cavities from a cleaning? It isn't common at all. No, in fact, I don't think I've ever seen that. So I'm sorry to hear that. I'm guessing you may have had something called a demineralized area where it was already quite thin and it had lost quite a bit of minerals. And that may have been where that led to. So remineralizing with the tooth powder is a great idea at this point. What happens if mercury fillings are already removed with no safety? Yep, that's a challenge. So what you're going to do now is you're going to work to detox your body. There's a company called Quicksilver Scientific. So check that out, Quicksilver Scientific. They have a lot of mercury detox protocols and mercury detox kits that make it pretty simple. So check them out. Any suggestion for gum recession? I'm 36 years old and have most of my bottom gums receded. That is frustrating. If most of the bottom gums are receded, most likely it's related to bite. So you need to do 2 phases of treatment here. You need to identify what is causing the recession. Is this just thin gums? Were you just born with it? Is it because your bite and the teeth are actually rocking and causing recession because of that? Is it because you have gum disease? So you need to identify what is the cause of the recession first off. Then once you've identified it, you treat that thing, the gum disease or the bite or whatever is needed to be able to be treated. You treat that. And then you work on actually rebuilding the gum through gum grafting. But people will tell me this all the time. I had gum grafts. It was terrible and it failed. Yeah, because you didn't stop and address what was causing the recession to begin with and then fix that. You can have gum recession on a gum graft as easy as you can on your natural gum. You have to fix the reason that the recession happened. Otherwise, it's going to just come back. What city do I practice in? I'm in American Fork, Utah. We get people from all over the country, all over the world, actually, though. So happy to see you if you want to come this way. What other options for implants? Ceramic implants are the best way to go. Ceramic or titanium are the 2 choices. I 100% will recommend ceramic over titanium. My son is 9 and is mouth breathing. What can I do, or who do we go see? A dentist or an ENT? So you're going to see a dentist that is associated or knows about growth and development issues. If you are not local to us, if you're local to Utah at all, come and see us. We have a whole team that's doing this. If not, go to toothpillow.com. So that's toothpillow.com. They have virtual help all over the country that can help you with this growth and development piece and help them start breathing through their nose again. Start there. What can be done if the root of the tooth on a 15-year-old is crooked? Thanks. If the root on the tooth on a 15-year-old is crooked, as long as it's not symptomatic and there's no issues with it, we leave it alone. We see crooked roots on people of all ages. So if there's no problem with the root, the tooth, it just is what it is. If there's a problem, then we deal with the tooth as needed based on the problem. But if it's not a problem, it's just a finding on the x-ray at that point. What about my daughter is 18 and she has a non-straight septum operation. Is an operation an option? So the septum is the center line here in the nose, and we can see these on the cone beam CT scan as well. A lot of times that septum will be deviated. Well, there's multiple reasons for it. Sometimes it's because the roof of the mouth is too narrow and everything can't quite stand up straight above that little narrow roof of the mouth. So we recommend expansion at that point. Sometimes it's because of an injury. You know, you get hit in the nose and it moves that septum. All of these things are signs that we look at. But it doesn't, just because you have a deviated septum doesn't mean that it's a problem. You know, I can have a deviated septum and I can breathe through my nose just fine. The key is, can you breathe through your nose? So we will do expansion of the roof of the mouth, which will expand the base of the nose and allow people to breathe even past a deviated septum. So you don't have to do the surgery. We just expand and allow for air around it. So it's really kind of, what are the symptoms related to this? My son is 6 years old. He's developed a tongue tie a year ago. I'm wondering why he developed the tongue tie. Interesting. Usually you're not going to develop it. It just may be that it's more visible now as he's getting a little older. There's different grades of tongue ties. There's severe ones that are often the ones they're going to identify as an infant. And there's moderate to mild ones that may show up as they're getting a little older. So most likely he had it. He has had it. It's just becoming more visible now as he's getting a little older. My son is 7 and hasn't lost any baby teeth yet. Why could that be? My other son lost teeth at 5. So some of it may be because the mouth is small. Are his baby teeth close together? If they're close together, there may not be room for the permanent teeth to come in. So it may be that you need to start doing expansion even in baby teeth with, again, this tooth pillow, toothpillow.com, with some of these expansion appliances to make room so the teeth can come in. What do you do about root canals? Do we leave a root canal alone ever? Tons of information on social media about this. Go check it out, about, that I've done root canals. But the key is, What is the status of that tooth? What does the root canal look like? My son got a baseball to the mouth when he was 11. He had a root canal until he was about 21. And then we removed that tooth. It was abscessed at that point. We removed that tooth at that point and replaced it with a dental implant. He couldn't do a dental implant till he was old enough to be able to be done growing and developing. So we had to wait. So the root canal was the filler. It held the tooth, held a bridge in place until we could get the tooth out. Some people, in fact, just yesterday, well, I guess it was this week, a whole bunch of people I saw. I said, you know what? These root canals actually look okay. They're on the list. We're going to talk about removing and replacing them, but they're not first. We're going to talk about this first, this first, this first. We prioritize. And it's always an option to leave them there. Honestly, the key is what is the health status of them. I see some root canals that look just fine. Are they? I don't know. Until we take them out and look at them, we really don't know this. But there's some on the CT scan that are not fine at all. There's huge abscesses in the bone. Well, those, there's no question. No, get that tooth out of there. But if they're looking okay, if your symptoms aren't set, if you don't have symptoms that are related to what might be, caused from this root canal, well, sometimes we leave them be. Do you have a directory for malfunctional therapists? I don't, but I'm going to work on that. There are some online, I believe, though. Should I sleep with my flipper in? My gums were inflamed in the morning. No, you should not sleep with your flipper in. You need to give those gums a chance to breathe. So take that out, give them a chance to breathe. Make sure you're rinsing the flipper really, really well and your mouth really, really well. Is traditional teeth cleaning okay to do? It is. Traditional teeth cleaning is okay. We like to add ozone to it, but it's not, you don't have to have that. But yeah, traditional teeth cleaning is okay. Would I recommend an implant or a bridge? It's all dependent a little bit on where the tooth is that you're missing, but always an implant. The reason is if when you do a bridge, you are affecting the teeth on either side because you're asking them to hold that other tooth. Well, it's going to compromise those teeth eventually. There's research that shows that one or both of those teeth are going to be lost within about 10 years of doing a bridge. So we call this making it a 3-tooth problem when it's really a 1-tooth problem. It's a 1-tooth problem. You're missing 1 tooth. Don't turn it into a 3-tooth problem. So an implant for sure. Do silicone bristles clean well, or is the BPA-free bristles better? I like BPA-free bristles. Silicone bristles are a little too flexible, I find. So that's why I don't choose those. Does your tooth powder have the silver in it too? It does not have silver in it because that's a liquid, but the mouth rinse does. My dentist recommended removing my wisdom teeth due to overlap of gum, but there are no issues. Well, it sounds to me like you're not able to keep the wisdom tooth clean, most likely. So there are things you can do, even using a real thick floss. They call it woven floss. Use it around the backside of that wisdom tooth and see if you can get underneath the gum and tuck it underneath there and really clean. If you can do that, you may be fine to leave them alone. What is the ideal time to wait between extraction and implant? I'm hoping to wait 10 months so my insurance will cover it. The ideal time is more than 3 months, less than about 12. So 10 months, I think you're in that window. I'm 51 years old. I'm in great health now. However, I still have several amalgam fillings. Is it important to have them replaced? I think it's absolutely imperative you have them replaced because every single year you have those mercury fillings in your mouth, you're accumulating more mercury in your system. Eventually, that mercury is going to affect your brain. It's going to affect your nerves. It's going to affect everything. It's cumulative. So get them out now before you continue building that mercury up in all of your tissues and systems. My 9-year-old sleeps with his mouth open. Can I tape his mouth while sleeping? You can, but guess what? If they can't get the tongue up to the roof of the mouth and make that seal, they really can't breathe through their nose. So what they're going to do is they're just breathing around the mouth tape. So it's really not fixing the problem. What you need to do is figure out, can we expand the mouth, move the tongue forward, make it so that the nose can breathe properly, and then the mouth closes on its own. Okay. I am going to just jump on this other one real quickly. I've got to get off today. I have to go. It's kind of some fun product development going on, actually. Let's just real quickly answer these, a few here. This is a great question. My daughter will be getting her wisdom teeth removed in your office in April. Is there anything she can do to prepare for the procedure? Any supplements that will help with healing? Absolutely. So it's really interesting. There are a lot of societies who did this. This is like there's a common thing you do before taking out a tooth or removing wisdom teeth or doing any of these things. And what it is you need to really make her primed for bone growth. So vitamin D3 and K2 and tooth and bone formula. If you look on my website, they're both on there, but basically it's minerals, vitamin D, vitamin K. Those are the things that you really need to hit hard so that she's able to grow bone. To find a dentist that does expanders for teens, is it in Find a Dentist? Yes, you're going to find it on our directory, but an orthodontist will do expanders for teens as well, although you're going to you're going to hit a little bit of resistance probably there. So check out toothpillow.com, but also check our directory. A lot of the dentists on there are going to be up your alley. What question should I ask my dentist before having a tooth pulled? How are they going to remove that? How are they going to clean the socket once it's out? And what are they going to put in the socket once it's removed? Those are the two big ones. All right, I'm going to answer this one last one. What causes teeth grinding and how can you stop? This is something I talk about all the time. I had a woman this week that she came and she said, I'm going insane. She's like, I catch myself grinding and squeezing my teeth all the time. I'm chewing on my cheeks. I'm chewing on my tongue. I cannot stop. What is going on? What is wrong with me? And I said, you can't breathe is what's wrong with you. We looked at her CT scan. Sure enough, her airway was almost nothing. She can't breathe. So what chewing on the cheeks, grinding the teeth does is it activates these muscles that hold the airway open and allows you to breathe better. So if you're grinding, you need to figure out, are you breathing? Most likely not. Get a sleep study and a cone beam CT scan. Thank you, everybody. I love doing this every week. I'll be back next week. Keep asking your questions on social media. We'll make sure to toss them up here at the beginning, so I always will get to them at the beginning. So glad you're here, and keep the questions coming. Love it.